Hi, everyone. Welcome. It is Wednesday afternoon or morning, depending on where you are, but welcome. I'm Andrea Shore with the School-Based Health Alliance, and welcome to today's webinar called School-Based Health Centers, and we're going to learn about the National Health Service Corps and Nurse Corps loan repayment and scholarship opportunities. A little bit about us, the School-Based Health Alliance. If you're not familiar with us, we work to improve the health of children and youth by advancing and advocating for school-based health care. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students already spend a majority of their time in school. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are managed better, behavioral health issues get quick expert attention, and we all know healthy students make better learners. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare where students already spend a majority of their time in school. So now we're going to go ahead to a few housekeeping reminders. So today's webinar is being recorded. That will be posted on our website within the next week, and you'll also get an email about the recording. So please feel free to share with colleagues who could not make it or join today. All attendees are in listen-only mode. And so to ask questions during the session, please use the Q&A icon that appears at the bottom of your Zoom control panel. When using the chat, that will only come from the panelists today, but they may be sharing some comments or resources with you. And if you'd like to turn on closed captioning, please click on the CC button at the bottom of your screen. Please complete the evaluation poll questions at the end of today's presentation. It's very brief. Okay, now I'd like to share today's learning objectives. We have two for today. We're going to inform constituents about the requirements and parameters of their NHSC site status. And the other purpose of today is to spread the word about the National Health Service Corps and Nurse Corps scholarship and loan repayment programs to increase workforce recruitment and retention at school-based health centers. And I have the pleasure of introducing today's two speakers. First, we'll hear from Melissa Lewis. Melissa serves as the chief of the National Health Service Corps Loan Repayment Program in HRSA's Bureau of Health Workforce. She has over 11 years of experience building healthy communities through the planning and administration of several national public health programs, and she enjoys blogging in her free time. Then we'll hear from Tina Simmons, who's a public health analyst for the Nurse Corps Loan Repayment Program, serving as the program policy lead. She has over 10 years experience in healthcare, serving in various roles, including clinical laboratory scientist, research compliance, and community health education. In her free time, she enjoys baking and having puppy playdates with her friends. So without further ado, I'll go ahead and pass it over to today's presenters. Thank you. Melissa, if you're speaking, we don't hear you.
Oh, I'm sorry. Hi.
Okay, there we go. Now we hear you. Okay, thanks.
Hello, everyone. This is Tina Simmons.
Oh, sorry, it's Tina starting. I'm sorry. Go ahead, Tina.
No worries. We're flexible. And I like, again, to thank everyone for coming to this presentation. So today's agenda will consist of an overview of the Bureau of Health Workforce, the Nurse Corps Loan Repayment and Scholarship Programs, and the National Health Service Corps Loan Repayment and Scholarship Programs, followed by questions at the end. The Health Resources and Service Administration, known as HRSA for short, is an agency that serves as the nation's public health safety net with more than 90 programs that provide healthcare to people despite geographic, economic, or medical challenges. HRSA is comprised of 5 bureaus and 11 offices, and through direct support to thousands of healthcare providers and over 3,000 grants and cooperative agreements, every year HRSA serves tens of millions of people living with HIV/AIDS, pregnant women, mothers and their families, and others who may not be able to access quality healthcare. HRSA Bureau of Health Workforce, also known as BHW, is uniquely positioned to address workforce challenges through the support of community-based training and programs that incentivize clinicians to work in rural and underserved communities. BHW investments in the health professions training programs allow innovative and flexible responses to the nation's emerging healthcare challenges. These same resources positively impact every aspect of a health professional's career, from education to training to service in the community and continuing education. Our mission is to improve the health of underserved and vulnerable populations by strengthening the health workforce and connecting skilled professionals to communities in need. And I want to emphasize the connecting skilled professionals and communities in need, because this is really how we take deliberate steps to look deeper into how we design our programs across the Bureau. By leveraging the expertise of our stakeholders, staff members like yourself, and asserting a data-driven approach has truly added value to the success of our programs. So now we'll start with a brief overview of the Nurse Corps. The Nurse Corps offers programs to help address shortages of nurses across the country. These include loan repayment to nurses who work in facilities experiencing a critical shortage of nurses, loan repayment to nurse faculty, and scholarships to students enrolled or accepted for enrollment in nursing degree programs. Through Nurse Corps, we have helped underserved areas meet their urgent need for nurses since 2002. The Nurse Corps program helps alleviate the critical shortage of nurses in high-need areas across the U.S. and its territories. Currently, there are more than 3,900 Nurse Corps participants serving at over 2,500 sites. Nurse Corps participants provide care to more than 4 million patients annually in urban, rural, and tribal areas. About 23% of our Nurse Corps clinicians work at a community health center or community health center lookalike. This is a list of the eligible types of critical shortage facilities, which include school-based clinics. For detailed definitions of the sites, please see programs application and program guidance on the Nurse Corps website, which will be provided at the end of this presentation. The Nurse Corps offers loan repayment to nurses who work in health centers, rural health clinics, hospitals, and other facilities experiencing a critical shortage of nurses, and to nurse faculty who teach full-time in eligible public or private schools of nursing. The Nurse Corps loan repayment program application cycle is now open, and you may be eligible for loan repayment if you are a licensed registered nurse, an advanced practice registered nurse, such as a nurse practitioner, a nurse faculty member with qualifying nursing debt. You must have received your nursing education from an accredited school of nursing located in the U.S., state, or territory, and you must work full-time at an eligible critical shortage facility in a high-need area or an accredited school of nursing. If awarded, you can pay up to 85% of your nursing education debt. The program will award 60% of your unpaid nursing student loans in exchange for 2 years of service. If you commit to a third year of service, we will award an additional 25% of your original balance. Half of all loan repayment program awards are set aside for nurse practitioners who are a critical part of the U.S. primary care workforce. Of the 50% allocated for nurse practitioners, up to 20% are available for nurse practitioners practicing in a psychiatric, mental, or behavioral healthcare capacity. These allocations expand the integration of mental health, substance use disorder treatment, and other behavioral health services into the primary care across the nation. The Nurse Corps also offers scholarships to nursing degree students who commit to practice at healthcare facilities with a critical shortage of nurses upon graduation. You may be eligible for a scholarship if you are a student accepted or enrolled in a diploma, associate, baccalaureate, or graduate degree nursing program. In exchange, you must work in an eligible facility with a critical shortage of nurses, a critical shortage facility, upon graduation. The Nurse Corps scholarships cover the following costs: tuition, eligible fees, annual payment for other reasonable costs such as your books, clinical supplies and instruments, and your uniforms, and a monthly stipend. The Nurse Corps Scholarship Program offers a funding preference for applicants with the greatest financial need. We determine an applicant's financial need based on the expected family contribution generated through the free application for federal student aid. Applicants with an EFC between 0 and 5,576 are considered to have the greatest financial need. The EFC is calculated by the Department of Education and not by the Nurse Corps Scholarship Program. So our last cycle, 2022 award cycle, the Nurse Corps Loan Repayment Program provided 2,071 new awards and 208 one-year continuation awards to nurses in exchange for a commitment to serve at a healthcare facility with a critical shortage of nurses or serving as nurse faculty at an accredited school of nursing. Our Nurse Corps Scholarship Program provided 567 new awards and 25 continuation awards to nursing students in exchange for a commitment to work at least 2 years in a facility with critical shortages.
Thank you, Tina. And I will now provide an overview of the National Health Service Corps Loan Repayment Program. My name is Melissa Lewis, and I serve as the branch chief in the Bureau of Health Workforce within the division of the National Health Service Corps. So the National Health Service Corps is a loan repayment and scholarship program that adapts to meet certain specific public health needs. For example, we have used the National Health Service Corps Loan Repayment Program to meet evolving public health needs, such as the substance use disorder pandemic. We've also used the programs to address and identify health shortages by incentivizing service in areas where clinicians are needed most. And we also support qualified clinicians by providing quality health care in high-need areas. The National Health Service Corps is an integral part in the Bureau of Health Workforce plan to overcome obstacles to access supply, distribution, and quality access to healthcare providers. The NHSC builds healthy communities by providing financial awards to primary care providers who are committed to serving in the nation's high-need, rural, urban, and frontier areas. Now we will give a
I always knew that I wanted to do something service-minded. I'm working in a rural area because I wanted to do public health.
My name's Hillary Homburg. I'm a general dentist. I'm currently located in Bell, West Virginia, which is on the campus of Riverside High School. About 90% of our patients have incomes below the federal poverty line. Most are either on Medicaid or on our sliding fee scale.
As much as it feels like.
I work with portable dental equipment. I'm actually set up in the fitness center here. Hopefully within the next 90 days, we'll be moving. The newest Cabin Creek Health Center site will have a 2-chair clinic, 2 operatories, sterilization lab, and front office. So it'll basically be set up like a small version of a private practice clinic. I would be working in public health even without the National Health Service Corps, but the wonderful thing about the loan repayment is it allows me to work with the patient population I'm passionate about without having to worry about the burden of paying back my loans.
To make sure that the market.
And the gratitude of those patients is really worth more than any monetary reward.
Thank you. And that video truly demonstrates the experience of a National Health Service Corps provider serving in the field. So now I will provide an overview of the impact of the National Health Service Corps. So in 2021, we awarded every single applicant, making that our largest class of clinicians ever. As you can see here, more than 20,000 NHSC members are currently providing care to almost 21 million people in the United States. And we also wanted to highlight that many of our National Health Service Corps members continue to serve in areas of greatest need well beyond their service obligation. So this is a highlight of our fiscal year 2022 application cycle. So as you can see here, we have 4 paradigm or programs through the National Health Service Corps where we help to address public health needs through loan repayment and scholarship programs. In 2022, we received over 13,000 applications and awarded over 9,000 clinicians. And I will provide a bit more details about each of these programs next. So first, our National Health Service Corps traditional loan repayment program. As you can see here, this program offers up to $50,000 for a full-time service and up to $25,000 for a half-time service. The service commitment is 2 years, and as I mentioned, either full-time or part-time service. Now, the National Health Service Corps Traditional Loan Repayment Program is our longest standing program and has been around for over 50 years. The next program is the National Health Service Corps Substance Use Disorder Workforce Loan Repayment Program. And as you can see here, this program is a 3-year service obligation for up to $75,000 for full-time service or $37,500 for half-time service. It is imperative to note that the Substance Use Disorder Workforce Loan Repayment Program was specifically created to combat the nation's opioid crisis. This program was first launched in fiscal year 2019 with a few specific aims. 1, to support the recruitment and retention of health professionals who were needed and are still needed to improve access to substance use disorder treatment across the country. We also strengthened the country's behavioral health workforce and benefit communities in need of substance use disorder services. Next is the Rural Community Loan Repayment Program. Similar to our Substance Use Disorder Workforce Loan Repayment Program, this program was also launched in 2019 and is a partnership with the Rural Communities Opioid Response Program, which is known as ORCOR for short. Dedicated funding is provided specifically for rural communities who are impacted by high overdose rates as identified by the Federal Office of Rural Health Policy. The Rural Community Loan Repayment Program also has a few specific aims. 1, to support the recruitment and retention of health professionals who are needed to improve access to substance use disorder treatment, specifically in rural areas, and also as a complementary to strengthen the country's behavioral health workforce. The next program under the National Health Service Corps umbrella is the National Health Service Corps Scholarship Program. Now, the scholarship program pays tuition and other expenses for students pursuing primary care careers. When these students graduate, they go to serve in underserved, high-need, rural, and urban communities. The disciplines that are eligible for the scholarship program includes physicians, both MDs and DOs, dentists, nurse practitioners, certified nurse midwives, and physician assistants. One of the major benefits about the scholarship program is that it includes tax-free payment of tuition, required fees, and other reasonable costs, and a monthly living stipend. For one financial year of support, scholar recipients are required to serve a minimum of 2 years of service obligation. The next program under the National Health Service Corps umbrella is our Student to Service Loan Repayment Program. Now, this is a hybrid between our loan repayment and the scholarship program. This specific program provides up to $120,000 for full-time service, which is a 3-year service commitment, or up to $120,000 for a half-time service commitment, which equates to 6 years of service. The Student to Service Loan Repayment Program participants, or applicants rather, are required to be enrolled as a full-time student in the final year of medical or dental school and be attending a fully accredited school in an eligible degree program. These medical students must complete an accredited primary care residency program in an approved NHSC specialty. Now, this program also accommodates dental students as an eligible discipline. While our dental students are not required to complete a residency program, they are highly encouraged to do so. Student to service recipients, another benefit under this program, are also eligible to apply to one of the National Health Service Corps Loan Repayment Program for a continuation award if they still have outstanding educational loans upon the completion of the Student to Service Loan Repayment service obligation. Lastly is our State Loan Repayment Program. The State Loan Repayment Program provides a cost-sharing grant to states and territories to operate their own loan repayment program. The grants to states are awarded for a 4-year period. In fiscal year 2022, we awarded 46 states, Washington, D.C., and 3 U.S. territories: Northern Mariana Islands, Guam, and the U.S. Virgin Islands, almost $100 million in grants to fund their own state loan repayment program. It should be noted that these state-run programs offer loan repayment to primary medical, mental or behavioral health, and dental healthcare providers, clinicians who are working in health professional shortage areas. Eligible disciplines for our state loan repayment programs and practice sites mirrors that of the National Health Service Corps loan repayment programs. For the state loan repayment program as well, the project period began in September 2022 and runs through 2025. Now, I just want to provide a quick snapshot of the eligibility requirements for each program that I mentioned earlier. For all of the loan repayment programs, we do want to note that the eligibility for this program includes being a United States citizen or national, currently working or applying to work at a National Health Service Corps approved site. You must have unpaid government or commercial educational loans and also licensed to practice in the state where the employer is located. We also have a list of the eligible disciplines here under the loan repayment program. I am not going to read all of them, but these are the disciplines that are eligible to apply to one of our National Health Service Corps loan repayment program. Next. The next program eligibility that I want to highlight, and I mentioned some of this earlier, is the Student to Service Loan Repayment Program. So similar to our National Health Service Corps Loan Repayment Program, these applicants must be United States citizens or nationals who are either full-time in the final year of an accredited school pursuing an eligible degree and have unpaid educational loans. And next, the scholarship program. So again, similar to other National Health Service Corps programs, they must be United States citizens or nationals, full-time student at an accredited school pursuing an eligible degree. Physicians are required to complete an eligible residency program, while our dentists and other disciplines are highly encouraged to do so. And just to confirm, the scholarship pays tuition, a monthly stipend, and other reasonable educational costs, and a living stipend. And it's available for up to 4 years of support. I do want to highlight a few other loan repayment programs that are currently administered under the Bureau of Health Workforce. And first is the Substance Use Disorder Treatment and Recovery Loan Repayment Program. Now, this program complements our National Health Service for Substance Use Disorder Workforce Loan Repayment Program and the Rural Community Loan Repayment Program. It was launched in fiscal year 2021 for the first time and awards up to $250,000 for an award for 6 years of service commitment, which should be full-time. Applicants must be trained and licensed to provide substance use disorder treatment at an approved substance use disorder facility. And one of the notable achievements about this program is that it expanded the eligible pool of disciplines and treatment facilities, which supports substance use disorder treatment teams. The next program, which is a forecast for what's to come in fiscal year 2023, is the Pediatric Specialty Loan Repayment Program. This specific program is authorized under Section 775 of the Public Health Service Act. While this program is anticipated to be launched in the summer of 2023, and we have received appropriation in the 2022 appropriation and most recently in the 2023 Consolidation Appropriations Act to fund this program. So the award amounts are currently pending approval, and the eligible disciplines that we have determined that will be eligible for this program based on the legislation includes child and adolescent mental and behavioral health providers and pediatric medical specialists and pediatric surgical subspecialists. I do want to provide an overview of the support and resources that are available for practitioners and participants in our respective loan repayment and scholarship programs, both under the National Health Service Corps and Nurse Corps umbrella. First, approved sites. So while we have highlighted here NHSC approved sites, as Tina mentioned earlier, we also have approved Nurse Corps sites. So specifically for NHSC approved sites, clinicians are expected to serve at these sites that are already approved throughout the nation under the National Health Service Corps umbrella. The sites include outpatient facilities that are providing primary medical care, dental, and/or mental and behavioral health services. The facilities must be located in a rural or urban or tribal community. And in order to apply to become a National Health Service Corps approved site, participants as well as sites are encouraged to visit our National Health Service Corps website. And I believe the link is also hyperlinked here in the slides where they can do so. Now, these are the types of sites that are eligible under the National Health Service Corps umbrella. Specifically, federally qualified health centers are FQHC lookalikes. We also have Indian Health Service facilities. And I also do want to call out that school-based clinics are also eligible service site types under the National Health Service Corps. We also want to highlight the approved substance use disorder treatment facilities, which are complementary to our National Health Service for substance use disorder programs. Now, these sites must demonstrate that they meet the requirements set forth in our National Health Service Corps Site Agreement and the National Health Service Corps Site Reference Guide. And so specific documentation are required and collected in order to prove that these sites meet the specific eligibility requirements to become a substance use disorder treatment facility. The types of sites that are noted here also aligns with our National Health Service for traditional eligible site type. However, I do want to point out that for purposes of the substance use disorder program, other eligible sites also include the SAMHSA Certified Opioid Treatment Programs, or OTPs, the Office-Based Opioid Treatment Facilities, also known as OBATs, and non-opioid substance use disorder treatment facilities, which are known as just simply substance use disorder treatment facilities for short. I will now continue with the support and resources, moving on to the supports that are available through our regional office. So through our regional offices, known as the Division of Regional Operations, we support providers within the specific regions. And as you can see here, we have 10 regions ranging from Boston to Seattle. So we have a dedicated staff of BHW analysts available in each region that serves as a dedicated contact and provide resources to our providers, our sites, and also potential applicants to our loan repayment programs. We do have a contact sheet on the NHSC website where you can find the point of contact for each respective region, and it's hyperlinked within the slides, and we encourage you all to utilize that in the event you have any specific questions about becoming a National Health Service Corps approved site. The next resource that's available is the Health Workforce Connector. The Health Workforce Connector helps to connect National Health Service Corps and Nurse Corps members with job openings at approved sites and facilities. Job seekers and approved sites can use the connector to easily search for and find eligible members for specific disciplines, HRSAs, and locations. We want to note that the connector is available to any provider of the program, regardless of their program affiliation, who wishes to practice in a community with limited access to healthcare. Along the lines of the Health Workforce Connector, specifically for the site profile, sites are able to, or have the ability rather, to build a site profile with open positions, community information, as well as their HRSA score. There's also a user profile feature allowing job seekers to upload their credentials, such as resumes and licensure documentation, and to create professional profiles. There's also a keyword and opportunity for a candidate search capabilities with advanced filtering features, and it's also mobile-friendly design. The next resource that I want to highlight are the virtual job fairs. Now, National Health Service Corps approved sites specifically benefit from the virtual job fairs in the following ways. One, there is assistance in the recruitment and retention of qualified and dedicated primary care providers through online interactive virtual job fairs, which are held at pre-scheduled times throughout the year. These virtual job fairs provide a full range of assistance to job seekers and NHSC approved sites by offering employment networking room facilitated by experienced BHW staff. Now, during the virtual job fairs, site representatives connect directly with those who are seeking jobs which include NHSC member clinicians, and they have an opportunity to promote their sites, their communities, and other benefits that their respective National Health Service Corps approved sites has to offer. Now, for application tips and reminders, we encourage everyone to sign up for email notifications through the www.HRSA.gov, where you can receive notifications on upcoming application cycles for both the National Health Service Corps as well as the Nurse Corps. I do want to highlight that the Nurse Corps loan repayment application cycle is currently open and accepting applications through February 23rd, 2023, 7:30 p.m. Eastern Time. We do want to provide a few key reminders for anyone who may be interested in applying to the Nurse Corps loan repayment program. So first, you must ensure that you submit all requested documents to be eligible for an award. These required documents include proof of U.S. citizenship, which can be in the form of a birth certificate, unexpired U.S. passport identification or passport card, a certificate of citizenship, a naturalization certificate, or a permanent resident card. You must also include your signed authorization to release information form, and this can be downloaded in the application. You must also provide your transcripts for each school attended for all nursing education coursework, which must have your name, institution's name, date of attendance, and courses you took. Your resume or CV, professional licensure, and certifications are also required. Your employment verification form must be completed by your site point of contact before you can submit your application. The employment verification form is only accepted electronically through the application by the authorized site point of contact. You're also required to submit your loan documentation and unlock or unfreeze your credit reports for the duration of the application review period. Make sure all documents are legible and meet program eligibility requirements. Failure to meet the program requirements will deem your application ineligible. And we also ask that you please review the application and program guidance for more details on eligibility requirements. As a final reminder, the Nurse Corps loan repayment program is accepting applications through February 23rd, 2023, 7:30 p.m. Eastern Standard Time. We do want to highlight that you can contact the Nurse Corps, and we do have the division's email address for both programs listed here, as well as a telephone number for our customer care center that's open Monday through Friday, 8 a.m. to 8 p.m. Eastern Time. You can also connect with us via social media, and the Facebook and LinkedIn links are noted here. You can also connect with the National Health Service Corps via email, which is noted here as well, along with the customer care center number, again, open Monday through Friday, 8 a.m. to 8 p.m. Eastern Time. Connect with us on social media through Facebook, LinkedIn, and Twitter, and those links are available here. And finally, connect with HRSA, and you can learn more about our agency at www.HRSA.gov, and you can also sign up for HRSA e-news notifications and follow us on all social media networks that are shown here. And we will now open up for questions. Thank you very much.
Wonderful. Thank you so much, Tina and Melissa. Thank you. That was wonderful. And we've got more people who've continued to join. Thank you all for joining today. I invite anyone who has questions for today's speakers, and also with Captain Ngo. We are open to have you drop into the Q&A box, and I'll go ahead and share those questions with the panel and see who would like to respond. And we do have, I do believe this question actually, Melissa, you may have just answered, but the first one that came in is, when will the National Service Corps application open up? And it sounds like you were saying it's open now. Do you want to remind the audience of the closing date?
Sure. So just for clarification, the Nurse Corps loan repayment application cycle is the cycle that's currently open.
Yes, thank you.
Yes. The National Health Service Corps Loan Repayment Program application cycles are not currently open, and unfortunately, we do not have a definitive date of when it would be. So we encourage everyone to sign up for email notifications, and we will also inform all stakeholders, including the School-Based Health Alliance, when the cycle is open, so that they can spread the word to their constituents.
Thank you, Melissa. Any other questions coming in? One question I did actually have that I thought maybe of interest to those who are participating today is, during the actual program, when you're participating, are there requirements along the way, or yes, anything mandatory or peer gatherings or anything that happens throughout, or is it just meeting the continued requirements through documentation?
So I can speak to the National Health Service Corps, and I'll turn it over to my colleague, Tina, to speak to the Nurse Corps program. However, generally, once an applicant receives an award, there's certain program-specific requirements that they're expected to uphold in order to for continued compliance with the program requirements. So specifically, the first thing that's going to happen is that they're going to receive a package with including documentation. Most important is the contract. So within that contract, they will receive, the contract will detail rather whether they're a full-time, part-time, or part-time participant, what's the required service hours based on the contract that they're under. For example, full-time participants within the 2022 fiscal year 2022, based on the contracts and program guidance that were out there, were required for 40 hours of full-time service, or at least 20 hours for part-time. There's also a requirement for providers to submit every 6 months in-service verification, which is completed by the site point of contact, just to ensure that they're not exceeding the allowable time away from the site, which is typically 35 days per service year. And so that's required to be submitted and turned in every 6 months while they're under contract. If there's any change in contact information, or if you're terminated from your site, or if you want to transfer to a new site, we also encourage you to communicate with your assigned analysts within your region or your within your state that can provide you with guidance before you make a move that could put you out of compliance. But I think overall for the National Health Service Corps, we encourage everyone to read the application and program guidance. It includes all of the information that you need to stay in compliance with the program.
Great, thank you. Tina, did you have anything else you wanted to share there?
Our program is similar. You are supposed to submit your ISV every 6 months, to ensure that with our program, it's only full-time. So that's 32 hours. So you submit your ISV every 6 months through your site POC, And if you wish to apply for a continuation, then you have to submit payment history and to prove that your funds went to your eligible loans.
Great, thank you. A few more questions have come in. Okay, and I welcome you all. If you'd like to stay on camera, you're more than welcome. Next question is from the audience: is registered nurses in a school-based health center are eligible for loan forgiveness? Is this correct? So asking confirmation of a registered nurse in an eligible school-based health center site, are they eligible for loan forgiveness?
Yes, those working at school-based health centers are eligible, granted that your site is located in an area with the HRSA and that you meet other program requirements.
Thank you. Next question that came in, if someone's qualified for both the NHSC and Nurse Corps scholarship, should they apply for both, or is it required to pick one to apply to?
So I can jump in here. So they can definitely apply to both. However, they would only be able to accept one program. So if, for example, the Nurse Corps sends out what is called a confirmation of interest notification first, and they accept that confirmation of interest, they would not be able to accept the National Health Service Corps offer, even if it comes after.
Great, thank you. I'll just give the audience another minute, see if anything else comes in. Very helpful, thank you. I don't see anything else coming in, and I do just want to, I believe everyone's been noting, but just in case you haven't had your chat box open, Wendy's been dropping fabulous resources along the presentation throughout, where you can find more information online about each program. And if there's anything else that you would like answered, you can drop it into the Q&A. And we'll give you another minute or so, but also want to remind everyone this will be recorded. So we please encourage you, especially if you're a school-based health center administrator, to please share this recording and slides with any clinicians at your sites who might be interested in applying. All right, Harper, I think we'll go ahead to our, Captain Ngo, were you going to add something?
Yes, hi. I just wanted to chime
Yes.
in and invite folks, site administrators, to go ahead and refer back to the slide deck. There was a hyperlink in there to reach out to our regional BHW staff. And so we're always happy to answer questions that site administrators may have about the sites, and then also some high-level questions about the programs as well. So we're always happy to support in that respect.
Okay, well, with that, I don't see any more questions coming in. Harper, we want to go ahead and put up our closing. Thank you so much. Any additional questions, you can always reach us at the Alliance, and then we will forward your questions on to our team of panelists here today if you need to get in touch with them and don't have that information on hand. Well, thank you so much. You're going to see an evaluation poll pop up on your screen, and we really appreciate your time today. And thank you to all of our panelists with HRSA. Really appreciate everybody's time. Thank you.